Let me start this recording. Okay, so we in this recording we just missed our nice conversation we just had. But so let's look at this reading. This is from yesterday. Actually, it says it was published March 9th. So what would that be? Sunday, and then updated yesterday. So it's new information. Now this is a very rapidly changing situation, right? But this is updated yesterday, so we can trust this is pretty much up to date information. So New York Times, it says coronavirus is very different from the Spanish flu of 1918. Here's how. Now, as a student, we want to get to know this reading as much as possible, as quickly as possible, because when you're taking that GED test, they give you a reading, and I think, if it has a title, the title is hugely important. And if it has subtitles, like section titles, those are always good. Now, on the GED test, I don't think that's very common that it has section titles. And this article does not have section titles, but it does have a subtitle. This is the title, and then it has a subtitle. It says, "The fear is similar, but the medical reality is not." Normally, between the title and the subtitle, if it gives it to you, you can figure out what this is going to be about, the angle that this article is going to take. So it says the fear is similar between today and 100 years ago, but the medical reality is not. So by the end of this article, we're going to see that. That's going to be explained. Okay, the similarities and the differences.
I can't see what he's showing.
Are you?
Okay.
Brittany, I thought I heard what you just said. I thought
I was talking about my husband.
That's okay. I thought you did a minute ago, didn't you?
No, my laptop, I'm still trying to get used to it.
Okay.
Yeah.
Okay, so that's what.
Well, click around,
Okay,
see what you
now
can find.
Now I see what you're showing.
Oh, good. Okay. Okay. Well, we can take turns. Sounds like pretty much everybody's got a microphone. We can take turns reading one or two paragraphs at a time. Let me get us started. And I just numbered the paragraphs just to make it easy. It says, it was a disease so awful that it terrified people for generations. The 1918 flu pandemic, thought to be the deadliest in human history, killed at least 50 million people worldwide, the equivalent of 200 million today, with 500,000 of those in the United States. It spread to every part of the world, affecting populations in Japan, Argentina, Germany, and dozens of other countries. Maybe most alarmingly, a majority of those killed by the disease were in the prime of life, often in their 20s, 30s, and 40s, rather than older people weakened by other medical conditions. Number 3, as the coronavirus spreads around the world, the public anxieties spike, as it spreads around the world and public anxieties spike, comparisons between today's situation and the Spanish flu pandemic of 1918 are proliferating in journalistic outlets and on social media. What does it mean? I highlighted proliferating. That's a good vocab word. Anybody, what do you think proliferating means?
I have no idea what that means.
Comparisons between today and 1918 are proliferating in the news and social media.
It's a big change in numbers.
Oh, I have no idea what this word means. I tried to translate it to my language and I could not find.
Oh, really? Yeah, proliferating is growing in number. Yeah, big change in numbers. Growing. Okay, like an increase. So comparisons, people are, if you look at the news and you look at social media, people are comparing this and wondering, and with good reason, that's what we're doing today, wondering how it compares to this, really the last big pandemic that the world has had, in 1918. So proliferating is a good word.
And plus it means like it's multiply.
Yeah, multiplying, increasing, yeah. Okay, paragraph 4. Brittany, could you read paragraph 4?
While the fearful. Okay, I can't read. Like, I suck at reading.
That's okay. All right, that's fine. I'm sure you don't suck at reading, but that's fine. If you want to sit this one out, that's okay. Carla, could you read? Do you have your microphone today?
Yes, I do.
Okay, read paragraph 4 then.
All right. While the fearful atmosphere, surgical masks, stockpiling of food, and avoidance of public gatherings and potential economic ramifications are like those of 1918, the medical reality is quite different. In 1918, the world was a very different place, even without the disruptive influence of World War One. Doctors knew viruses existed but had never seen one. There were no electron microscopes, and the genetic material of viruses had not yet been discovered. Today, however, researchers not only know how to isolate a virus, but can find its genetic sequence, test antiviral drugs, and develop a vaccine.
Okay, good. Thank you. So, if this was a reading on the GED test, I think you would anticipate there being questions afterwards about similarities and differences between these two time periods. So let's be very mindful. Let's pay attention of similarities and differences. So they say, while the fearful atmosphere and potential economic ramifications are like those of 1918. You've probably seen in the news, surgical masks, stockpiling of food. People were now supposed to, you know,
Yeah, my friend told me about that stuff today.
yeah, like going on right now. Yeah.
Yeah, they're stocking up toilet paper, sanitizer, all that.
Yeah, and that's, maybe that ends up being smart and wise, and maybe it's not called for. It just depends because it says avoidance of public gatherings. What they're talking about today is they mention social distancing, right? Because we know today that this is a virus and viruses are transferred from person to person, like through the air when you cough or whatever. And so
Yeah,
by
and I
avoiding,
heard that virus can actually kill people.
well, yeah, it can. Yeah. So that we're going to get some statistics in a little bit here in this article. But so, today they're using the term social distancing, keeping your distance from people, not going to big gatherings. Back then, 100 years ago, they talked about not having, it says avoidance of public gatherings. They closed down movie theaters, they closed down schools, um, similar things. So similar things. The differences, the main difference they talk about here is medical. Medicine and our understanding of illness and viruses is way better than it was then. So hopefully that serves us better. We can do a better job fighting this thing. So
Yeah,
let's
but over 1,000 people almost died from it.
yeah, oh well, I mean it's a serious thing. Yeah. So, and again, things are going to change pretty rapidly. Hopefully we in America don't have a giant outbreak that people must be fearing. I don't know, like we said, it doesn't feel yet like there's an emergency. Now, of course, people, we all just kind of worry about ourselves. So until it happens to us or our family or friends, we're going to say, what's the big deal? But, you don't really know what's going to happen yet.
I'm just hoping it doesn't hit where I'm at.
Yeah. Well, yeah. We're all we're all hoping that, yeah. Colin, could you read paragraph 5?
Me?
Colin, do you have your microphone? Not Carla. I'm sorry, Khaled.
It's okay.
Khaled, do you have a microphone? Oh, I thought so. Maybe not. Nadia, why don't you read paragraph 4? I'm sorry, paragraph 5. Nadia? Having a tough time today. Oh, Nadia's driving anyway. Maybe she's not.
I'm sorry. Yeah, I can read it now.
Oh, you
I
sure?
just
Okay.
needed to pull over
Oh, no.
somewhere.
Okay.
But
Well,
that's okay.
okay. Thank you.
In 1918, it was impossible to test people with mild symptoms, so they could self-quarantine. Quarantine? How can I pronounce?
That's a Q. Quarantine. Quarantine.
Quarantine. Thank you. And it was nearly impossible to do contact tracing because the flu seemed to infect and panic entire cities and communities all at once. Moreover, there was little protective equipment for healthcare workers, and the supportive care with respirators that can be provided to people very ill with coronavirus did not exist. With a case fatality rate of at least 2.5%, the 1918 flu was far more deadly than ordinary flu, and it was so infectious that it spread widely, which meant the number of deaths soared.
Okay. So thank you. So this paragraph just focuses on the 1918 flu. And it was, what does it tell us about this? It was impossible to do contact tracing. What they're doing today is when somebody new gets sick in a new place, they interview, it's like people go and they interview that person and say, well, have you traveled to, have you been traveling much lately? Who have you contacted? And so they can, I guess it's called contact tracing. They can trace back where that person got it. And they can say, okay, in the last 2 days you've been sick. Who have you contacted? Who have you been around? So that person's family, or maybe if they went to a sports game, they can, trace whoever went to that sports game too. So they can trace, I guess it's called contact tracing. There was little protective equipment for healthcare workers. They didn't have respirators, big machines that help people breathe. They said it was far deadlier than the ordinary flu. Right, we do have just the regular flu, which if you're a regular, more or less healthy person, you get the flu. Yeah, it's no fun. You're sick for a few days, but then you get better. But there's some people, people who are, have weak immune systems, or maybe the elderly.
Yeah, like I have. I have weak mucus, so it's hard for me to get better.
Right, yeah. So the flu, a regular old flu, most people can handle it and it's no big deal. Some people get the flu and it's actually dangerous. I mean, that's just the regular flu that's always around us every winter. Many people die across the country every year just from the regular normal flu. But we all just accept, really. I mean, it's tragic when anybody passes away, but we all just accept that, okay, there's lots of illnesses in the world, and sometimes you get sick and unfortunately some people die from them, but the regular flu, we all just are used to it, so we don't think about it really. But actually, many people die every year. I think they're going to give us a number later in this article. Many people die every winter from just getting the normal flu. So that's, something to think about, to compare to. Tolulope, could you read paragraph 6?
Yes. Researchers believe that the 1918 flu spared older people because they had some immunity to it. They theorized that decades earlier there had been a version of that flu, that virus, one that was not as lethal and spread like an ordinary flu. The older people living in 1918 would have been exposed to that less lethal flu and developed antibodies. As for children, most viral illnesses, measles, chickenpox, are more deadly in young adults, which may explain why the youngest were spared in the 1918 epidemic.
Okay, could you read paragraph 7 as well?
Regardless of the reason, it was a disaster for life expectancy, which plummeted. In 1917, life expectancy in the United States was 51 years. It was the same in 1919, but in 1918, it was just 39 years.
Okay, thank you. So that explains that the 1918 flu didn't really hit older people because, and this is looking back, historians looking backwards think that maybe those older people had already been exposed to some version of that virus and so they were immune to it. So by the time the 1918 flu came, they had some immunity to that disease, whereas younger people didn't. And so, but enough people were dying of this 1918 flu pandemic that it took life expectancy, which is the average age that you can expect to live to. In 1 year, it went from 51 years to 39 years in 1918, which was the focus time of this flu. Then it went away. It played its course. I guess enough people became immune to it. And by 1919, it wasn't a big deal, and life expectancy was back to 51 years. But there's so many people died of this flu in the year 1918 that life expectancy dropped from 51 to 39. That's huge. That's huge.
Very.
So paragraph 8, it says the new coronavirus. Now here we're going to compare. Okay. It says the new coronavirus tends to kill older people and those with underlying medical conditions, and it does not seem to kill children. It's kind of harsh they're using the word kill. All of which means it will have far less effect, if any, on life expectancy. As for the coronavirus case fatality rate, which means how likely are you to die if you get sick, what are the chances that you'll die if you get sick? It is not yet known, but the latest data from South Korea with 78 confirmed infections show a rate significantly higher than the seasonal flu, the regular flu. After testing 100,000 people for the virus, the country appears to have a case fatality rate of 0.65%, though the data is evolving as researchers in other countries track cases. So part of the reason they want people to get tested is so that they can gather information, right? If people are only going to the doctor when they're super, super sick, let's just say, let's do a little math experiment here.
Oh, no more math.
Just a little light math. So if people only go to the doctor when they get the coronavirus, when they're super sick, like gonna die super sick, and 100 people, let's say in a town, 100 people die of the coronavirus, and 110 people went to the doctor. That means 100 out of 110 people died. Let's change it. Let's say 90 people out of 100. Let's make it 90%. That means, oh my goodness, if you get this virus, you have a 90% chance of dying. Okay? But let's say there's 900 people who have the virus but don't feel quite sick enough to go to the doctor. Maybe they take a little medicine, they take a day off work, and they recover and they're okay. They fight off the virus without dying. Let's say there's 900 people who don't go to the doctor. Well, that's going to affect our understanding of the virus, right? Is the fatality rate 90% or 0.9%? That's the difference between all those people who do have the virus but don't feel too terrible, if they don't get tested, then we're not going to know they had the virus. You see what I mean? So the more people get tested, we may realize that this virus isn't quite as deadly as we think. And it's true. This isn't this isn't like some zombie apocalypse movie where, 50% of people who get this illness are going to drop dead. It is not.
Like The Walking Dead.
Yeah, it's not like that, right? We're still worst case scenario, and truly the 1918 virus at max, worst case scenario, it was about 3.5 or something, 3% fatality rate. Okay, which means if you get it, you're probably going to be okay. But on a country scale, when you have millions of people getting it, that means a lot of people are going to die. It's a tiny percentage of the people who get sick. But as a country or the world, it means lots of people may die. So this isn't like 50% chance of death. It's like 1 or 2 or 3%, right? So, which isn't good, still not good.
Yeah.
If somebody told me there's a 3% chance that I'm going to die today, I wouldn't be too excited. But, it's not, this isn't good news, but it's something you just, anytime there's something like this, you have to have good information. It has to be trustworthy information, and up to date, because things change rapidly. Let me read paragraph 9. It says, what the current situation does have in common with 1918, though, is the tenor of public concern. Tenor means like the tone. Like a tenor is a type of singer, right? A person with a tenor voice. So it kind of refers to like the tone or the feeling of public concern, the tenor of public concern. Among the first places in the 1918 flu, among the first places the 1918 flu arrived in the United States was Fort Devens near Boston. So many young soldiers were sick and so many were dying that the Surgeon General sent 4 of the nation's leading doctors to investigate. One of them, Dr. William Vaughan, later recalled hundreds of stalwart young men in the uniform of their country coming into the wards of the hospitals in groups of 10 or more. They are placed on the cots until every bed is full, yet others crowd in. Their faces soon wear a bluish cast. A distressing cough brings up the blood-stained sputum. In the morning, the dead bodies are stacked about the morgue like cordwood. Okay, so again, this flu affected young and middle-aged people 20 to 40 years old. The coronavirus today is not the younger you are, the better you are. But this is during World War I. Like this is crazy to think. This is during World War I. So you have millions of young men in America who are fighting in World War I, coming home from Europe, around the world, coming home, bringing this illness with them. And then it starts, it says among the first places was this camp fort near Boston. There was like a training ground for soldiers. And so these young men, it was affecting young men especially, they would come in and, it says by the morning, dead bodies were stacked about the morgue like cordwood, like firewood, which is a pretty colorful way to paint the picture. So it was deadly, and it was deadly for young people. And so here we go. So this says accounts like these scared Americans deeply, and it gives us 2. This is a poster, and this is an article. So this is, and these are good for us as we prepare for the GED test, because sometimes on the GED test you're going to be given a graphic. It might be a map or a chart, and it might be something like this. This is on the left. We have a poster, a flyer. It says, let's look at the caption. It says a flyer published by the Chicago Department of Health. And this is a warning. there's a lot on there, so we're not going to read everything. But it says influenza, frequently complicated with pneumonia, is prevalent at this time throughout America. This theater is, okay, so this is a flyer they would hang up in like a movie theater. This theater is cooperating with the Department of Health. You must do the same. If you have a cold and are coughing and sneezing, do not enter this theater. Go home and go to bed until you are well. So this is a sign hanging in a theater. It's kind of interesting. And on the right-hand side, this is a newspaper clipping. Drastic steps taken to fight influenza here. Health board issues. This is news to people. Health board issues 4 p.m. closing orders for all stores except food and drug stores. Hours for factories fixed. Timetable for theaters. So this would be out of the newspaper. And who knows? Look at this flyer on the left-hand side. Maybe we will get to a point where we see signs hung by our local government or health officials telling us.
I've already seen some.
Are there signs? Yeah, maybe. Well,
Yeah, I've seen some. I was just out yesterday at a concert and they had a sign up for the coronavirus. Yeah.
Now was it like what was it? What did that sign say? Like if you are sick, don't come in, or
It was kind of like it was a sign, yeah, like if you've traveled to like China or been in contact with somebody from China, you should, get tested, and then they listed the symptoms for the coronavirus on there.
Yeah.
Yeah.
And that's
I have one of my cousins are actually she's with her mom who's from Italy. They went to Italy a couple weeks ago to take care of family business, and then the government shut Italy down, so
Yeah.
they're not going to be able to return until they open it up
Oh,
again.
really? Oh, wow. So yeah, it is real. It's getting real, and it's scary as Americans to see signs like that. Like we think of that as like this is, this sign here is from 1918, World War I's going. Like we're not used to seeing warnings from our government, and that's a little alarming. But, don't be alarmed, be smart about it, and the hope that everybody has is that if we can do these precautions now, it won't explode into a big epidemic where everybody in America gets it. That's the hope and the assumption.
Yeah, like so far it's not hitting where I'm at though.
Right. Right. And
So I live in Altoona.
oh, okay. Okay. And maybe it won't. Maybe a month from now, I don't know. Maybe a month from now, this time next year, a year from now, maybe we will have a big countrywide thing on our hands, or maybe we won't. I don't know. And maybe all this, who knows? Maybe all these precautions, the colleges closing down classes and concerts getting canceled and the NBA games getting canceled. Maybe it's helping. Maybe it doesn't make a difference. I don't know. We can only hope and assume that it will. And we as Americans are being asked to do something. And so just like they did 100 years ago, we can pull together and be smart about it. And whether or not it helps your family, maybe it helps your community and the country as a whole. I don't know. It's interesting.
Okay.
Go ahead.
Okay. Yes. If they close colleges, they can move everything online. They can move high schools online. They can move even middle school online. What about elementary school and childcare when parents have to go to work? And usually viruses can be spread really fast among the kids.
Yeah. Kids aren't always the cleanest. I know. Yeah, no, definitely. I don't think we're all going to there's not going to be police roaming the streets, arresting people if you leave your house. I think we're being encouraged to if you can avoid big gatherings, and there's there's people canceling concerts and meetings and sports games. You don't have to stop going to the grocery store. You don't have to stop taking your kids to daycare. If you need to take your kids to daycare, then you got to take your kids to daycare. You know, the schools are tough. Colleges, just even yesterday, it seemed like a waterfall of colleges made a lot of changes. If schools, elementary schools, middle schools, high schools follow, that will be interesting to see, because maybe maybe some high schools could pull off working online. But yeah, I mean, the average elementary school kid's not sitting there on the
Yeah, we
computer
can't
for
leave
6
kids alone.
hours.
I'm lucky. Actually, I'm lucky. My daughter is 12. Oh, my younger one is 12 now, so I can leave her alone. But for families who have small kids, they can't leave them alone at home and go to work. And maybe they can't leave the work, especially singles mom. We have to make money. We have to make living.
Yeah, yeah.
I
No, and
know the
so,
flu's been going around a lot, though.
well, I mean, yeah, if they do something with schools, then I can trust it must be a big deal, because the people who make these decisions, they know that is a huge, huge inconvenience to families. So if
Yeah,
they
like my
do that,
son got sick like 5 times already
yeah,
from flu.
yeah, and so if they do that drastic step, then we can assume it's for a very good reason, you know. And
Mm.
we'll see, you know. We'll talk once a week, and we'll see this time next week what happens. Okay, so let's focus here. Let's see if we
Oh,
can
that's
finish this up.
hold up.
Yeah,
Hello?
yeah. You there?
Yeah, I'm here.
Okay.
Hello?
Yeah, I can hear you, Brittany.
Oh, never mind. That number just called me and no answer.
Oh, okay. Okay, so let's finish up. There's only a few more short paragraphs here. Again, we're comparing and contrasting. There's similarities and there's differences. So it says on October 3rd, 1918, Philadelphia closed all schools, churches, theaters, pool halls, and other gathering places. Now this is really city by city. And if you look back at the history, it is cities were making these decisions. Not necessarily
Wow.
across the country or even
Aimbot.
across the state, but just cities were making
Dude, you should never.
decisions.
You should never been able to hit me.
It says undertakers who, prepare bodies for burial were overwhelmed. Some funeral homes increased their prices sixfold, and some even made the bereaved bury their own dead. That's kind of scary. In Tucson, Arizona, the Board of Health forbade people to venture out in public without a mask. In Albuquerque, that's New Mexico, where schools and theaters were closed, a local newspaper wrote, "The ghost of fear walked everywhere." Similar actions are being taken today. Seattle has closed some public schools, it says. The South by Southwest Festival in Austin, Texas has been canceled. Apple, the company Apple, asked employees to work from home. More than 2,700 people are under some sort of quarantine in New York City, and some Costco stores are having trouble keeping bottled water in stock. So people are preparing, and different local governments, city governments, are making their own decisions when necessary. It says, paragraph 14, but so far this year, the annual epidemic. Okay, now this is interesting. We'll compare real information, real numbers. The annual epidemic of seasonal flu, regular flu, in the United States is proving much more devastating than the coronavirus. The Centers for Disease Control and Prevention reports that there have been at least 34 million people infected with flu this season, just a regular flu year, 350,000 hospitalizations, and 20,000 deaths. That's just regular flu, and we don't even think about that. So it says, so far, coronavirus has killed 27 people in the United States. 27 compared to 20,000.
Hmm.
So I think, if anything, I think we can look at positive and negative. The negative is that, yeah, there's a disease here, and 27 people in the United States have died. And I think, what is it? It's over 2,000 or something around the world so far. So people, this is a real deal. But just regular flu, just getting the sick, getting people sick every year, 20,000 people die from the flu just this flu season, since throughout the winter. So the positive is that, yes, this is scary. You're seeing signs when you go to a concert. We're having schools close and everything's, it's scary. But I think the positive, at least right now, is that we're not responding to a full-blown crisis, because as we said at the beginning, it doesn't feel like a crisis to me yet. We're not responding to a huge crisis in our communities. I think we're trying to prevent a crisis. And I'd much rather be in a position of preventing something terrible from happening than to reacting when something terrible does happen. So that could be our happy takeaway from this story. So paragraph 15 says, for the economy, now the economy is actually a big deal. For the economy, the effects of the 1918 flu, despite factory closings and social disruptions, were hard to disentangle from the profound ones of World War I. It's hard to understand how the flu then affected the economy, because World War I was also happening, and it's hard to tell what was because of the flu and what was because of the war.
It was
Plus
because of the war.
Yeah, the war was, you can't underestimate how big of a deal World War I was. So it's also going on. So
Well,
it's hard
how
to
I
tell.
know is because my grandfather that died was in World War One.
Oh, really? Oh, wow.
Yeah.
Yeah, so this is happening at that same time. So it says also, I think another big thing was, the world was not as interconnected as it is today. Think of plane travel. And it says, and by the summer of 1919, the pandemic has ended. So it basically played itself out in a year. And maybe this will too. I don't know. Coronavirus is already having significant impacts on the stock market and other aspects of the economy, but the long-term consequences remain to be seen. So yeah, I think, like I said, we are trying to prevent a crisis rather than reacting to a crisis. So I think that's a good thing. So if we can all be smart and do what we can individually and as a community, if you can prevent the spread, hopefully it works.
You're basically saying about the flu not going around as much, right?
Well, that's why, that's why we're being asked to, the colleges are closing classes and things are being canceled. It's to prevent the spread. That's why. Hopefully it works. I don't know. Hopefully it works.
Yeah.
So, let's real quick, let's look at this other resource I have. I'll send this out. I'll email this out. So at the bottom of this article, this is what I'm going to send you. What we're looking at right now is what I'm going to send you. At the bottom, if you click on this, this is the CDC, the Centers for Disease Control and Prevention, the CDC. And it's in the news a lot. There's a timeline of the 1918 flu and a gallery of historical images. So let's jump to that. Where are we? Okay, so this is a web page that it'll take you to if you click on that link, and it's a short little history. And then there's a gallery of historical images. Let's look at these.
So this little bastard stole my body shield and decides to give it back.
These are kind of neat historical images from 100 years ago. Okay. Signs in the windows, keep your bedroom windows open. There's a big push for fresh air. They wanted people to get fresh air. What else? There was a Red Cross volunteers. They had a shortage of nurses. This is them holding open air police court. So they really thought that fresh air. They really didn't understand germs and viruses and how viruses spread. So some cities banned big gatherings of people. Others said, well, what's the big deal with people? What matters is fresh air. So get outside and get fresh air. So they would do things like hold court. This is a court. This is police court. They're having it outside. So that was some things that would happen. These historical images are kind of interesting. And then there's a timeline, and I think timelines are important to be able to understand too. Now this timeline goes top to bottom, and it covers 1917, and you could, feel free to check this out later. 1918, April 1918, first mention of influenza appears in an April 5th weekly public health report. The report informs officials of 18 severe cases and 3 deaths in Haskell, Kansas. So it kind of becomes a thing, a concern in early 1918. By May, hundreds of thousands of soldiers travel across the Atlantic each month as they are deployed for World War I. And by October, okay, so you first read about it in the paper in April, and then by October, it says the virus killed an estimated 195,000 Americans during October alone. So it was spreading, that's for sure. It kind of came in 2 waves. There was a spring wave, and then the flu, the virus sort of went away for the summer, and then it came back stronger in the fall. And as you see here, in October, in the month of October alone, 195,000 Americans died in just 1 month. So it came back they talk about 3 waves actually of this virus. The spring of 1918, the fall of 1918 was the worst, and then it came back in the spring of 1919, but that wasn't too awful. So this, timelines are good. I like timelines. They help you understand how things occurred one after the other. I like a good timeline. This is a neat timeline with the dates and pictures and things. So I'll send this out to everybody. Brittany, how about you in the chat? Why don't you give me your email? And actually, Khalid, if you could give me your email in the chat as well, then I can email you. So yeah, you two do that. I'd appreciate that, and I'll send you this recording of the class. I'll send you this article, everybody. And there's some other information at the bottom, which is interesting.
Yes, we do.
So actually, I'll tell you I'll do what I've done in the past. I'll give you my email. Let me put that in the chat here. And then I can never type and talk at the same time. Okay.
There.
Oh, Brittany, there, I got it. Okay. Let me write that down. I will send out this probably after lunch here this afternoon. And if you guys if everybody's able to log in next week, we'll do something again. I think last week when we talked about prohibition, we talked about the constitutional amendments. I think next week we'll pick up there, and we'll talk more about the Bill of Rights and the First Amendments after they wrote the Constitution. So we can look at that a little bit more. And that's a good balance between the civics and the government and the history side of things. You know, but yeah, I hope you found this interesting. I think certainly, I think it's good to understand a little bit of history. You know, if something like this has happened before, it's good to understand what that was and learn lessons from the past. And even though nobody's asking my opinion on things, you know, certainly none of us are making the decision of what schools, if schools are going to stay open or anything. It's good, even if we're just reacting within our own family, we can have the best information, have an understanding of things, and hopefully, you know, I think we'll all get through it. But it's a kind of a crazy, scary time, and we'll just have to see what happens, I suppose, huh?
Mm-hmm.
No. All right, everybody. Any
Yes.
questions about this?
Mm-hmm.
No, thank you. It was
Nope.
so
No, it was a
interesting.
very good class.
Good.
Thank you.
Good.
Yep. Thank you.
All right, everybody. Super. Well, I'll send out an email later, and yeah, have a good day. I hope to talk to you next week then.
Now,
Thank
do
you.
we start that
You
today?
too.
Brittany, what's that? What's your question?
I said, do we start that today?
We'll start what? What do you mean?
The schoolwork.
Oh, well,
This class, oh,
yeah, this class that I do once a week, this is in addition to whatever distance learning you're doing. You know, you're working probably with one other teacher and working on whatever. This is just, I call this a drop-in class because it can be anybody who's studying with the distance learning project. Anybody's welcome to join us. Even if you're,
Okay.
you know, not necessarily even preparing for the social studies test at that time. You know, anybody's welcome. So I'm not giving you any homework. You have nothing to do for me. All I ask is if you're free, to log in every Thursday with you. You know, totally up to you if you want. But you know, I don't have any work for you, so that would be up to you, between you and your teacher.
Okay.
Okay.
I'm having a hard time hearing you now.
Oh, okay. Well, no problem. Anyways, thanks everybody. Thanks everybody, and have a good day.
You too.
All right.
Bye. See you next.
Bye.
bye. Enjoy the rest of your day.
Yeah. Thank you.
Thank you. Be safe, everyone.